Venography. This type of study is most often performed on the lower extremities as opposed to the arms and commonly involves the femoral vein, described here. A local anesthetic is applied over the site where the catheter is to be introduced. The vein is percutaneously punctured with a needle and a guide wire is fed through the vein to the point where dye will be injected. A catheter is threaded over the guide wire and the guide wire is removed. Contrast medium is injected and a series of X-rays performed to visualize the vessels and evaluate any abnormalities.
In venography, contrast medium is injected into the catheter that has traveled to an area upstream of the site under investigation. These codes report the radiological supervision and interpretation only. Use a separately reportable code for the catheterization. Percutaneous transhepatic portography, with hemodynamic evaluation, RSI. Without hemodynamic evaluation, RSI. A radiographic exam of the portal vein of the liver is done by inserting a needle through the abdomen. The patient's right side is cleansed and a local anesthetic given at the puncture site. A needle is inserted into the skin just under the ribs and diaphragm and advanced to the liver under fluoroscopic guidance. The needle is aimed at the portal vein and when blood returns from the needle, a small amount of contrast is injected to confirm placement into the portal vein. When in place, a guide wire is inserted and a catheter follows. More contrast is injected, radiographs taken, and intravenous, hemodynamic pressures in the portal vein are recorded. This code reports the radiological supervision and interpretation only. Use a separately reportable code for the catheterization. Hepatic venography, wedged or free, with hemodynamic evaluation, RSI. Without hemodynamic evaluation, RSI. A local anesthetic is applied over the common femoral vein and a guide wire is fed through until it reaches the hepatic vein. A catheter is threaded over the guide wire and the guide wire is removed. For wedged hepatic venography, the catheter is wedged into a small hepatic vein branch to approximate the portal pressure occurring in liver disease. For free hepatic venography, the catheter tip lies free in the hepatic vein. Correct positioning of the catheter is monitored by fluoroscopy. Contrast medium is injected into the vein and X-rays are taken. Report 75889 if this is done together with hemodynamic evaluation in which blood movement through the liver is monitored by indwelling catheters connected to transducers. The pressure forces within the arteries and veins are converted to electrical signals and displayed on screen. Venous sampling through catheter, with or without angiography, e.g., for parathyroid hormone, renin, RSI. Venous sampling involves withdrawing blood from a patient's vein into a vacuum tube to test the blood for excess hormones. Single or double catheters may be used for sampling. The catheter, S, is inserted in the femoral vein, S, and maneuvered to the vein in the anatomical location in which the testing is to be performed. When the catheter is correctly placed, several blood samples are withdrawn.